All right, welcome everybody. We got another edition of our Practitioner Spotlight. This week, we'd like to welcome Chad Graham. Chad's been another experienced MAT practitioner. He started the process, finished a specialist program in 2003, so almost 20 years of experience in the process. He got his master level certification in 2011 and then moved through the RX process in 2000, finished that in 2015. And so obviously a lot of experience with MAT. It's been pretty neat to see the growth and what Chad's done with the process over the years. He's been working with the Indianapolis Colts for many years and as a consultant, and he's had some great experience with MAT, and that's what I really kind of like to talk through with Chad today. It's kind of how that all progressed. So first off, welcome, Chad. And
thank you.
Thank you for being here.
Yeah, happy to do it.
Good. And so wanted kind of first off, I guess the first question, so 2003, you came to and got your certification as a specialist, and obviously that's a commitment in itself. But where were you and what were you doing prior to MAT, and what exposed you to MAT to get you to go through the program?
Well, initially I was a personal trainer. I got my degree in kinesiology. I moved to Chicago and I was working with one of the Bears sports doctors to try to do some kind of specialized rehab with training. And then a year or two into that, I moved to Indianapolis, and I had seen you speak out in Philadelphia, I think in 1999, and saw some of the things that you were doing with your evaluations. And you hadn't mentioned MAT at the time, but I knew that whatever you had was something that I wanted to pick up on and maybe become a better trainer. Saw you again the next year in Chicago. You briefly mentioned MAT, and to be honest, unlike a lot of people, I blindly signed up for the course out in Denver, not knowing what I was getting into, and it ended up being an entirely new career. Wow. And so I took that leap, jumped into it, figured out how to pay for it, and here I am. So
that's great. And then how did it change your career? So what you were doing, like you said, you were tied in with the rehab side of it and as a personal trainer, but how did it impact or change your career, and what direction did it lead you into once you got the MAT certification?
Well, I mean, initially I started this out of a large facility and wasn't sure. I knew that I had something. Every time I would come back from Denver, I would take what I had learned and start working with people. And as I got to the end of the course, I had watched somebody who had a foot drop situation walk across a catwalk into our building, to where when she would walk, you would just painfully watch her go across. And by the end of the MAT program, you would watch her walk, and it was almost like there was no problem. And so I knew I had something powerful at that point. And so I again took that leap. I blindly turned in my 2-week notice where I was at. I had a full slate of personal training business, no clue really. I didn't have a building set up. I didn't have anything set up to do this on my own. And away I went. 2 months into starting my practice, I was working with one of the president of an NBA team here, and they called me and said, "Hey, we have a trainer out. Would you want to fill in for them?" And did that, and I ended up doing that for a couple of years as I was building my business on my own, and that transitioned into the Colts finding out about it, and that was I just finished my 16th season with them, so I believe it was around 2005 when that was, and then just gradually kept building my practice from word of mouth, and have really not spent a penny on advertising. So wow. It's been a pretty incredible process.
Yeah, that's what's great. And I guess the question on that is, obviously, I mean, personal training. I mean, there is a strength and conditioning side to the sports medicine, but the personal training and the background, I mean, what are the opportunities to get with pro sports as a personal trainer? Like, do you feel like you could have had those opportunities without this specialty?
Yeah, I
What
mean,
you,
I definitely wouldn't have. I mean, it honestly wasn't something that, I mean, it's something you always think about, but at the end of the day, the odds of getting into something like that without having some kind of niche expertise like this, I think would have been probably impossible. And so the doors that opened up with that because of the knowledge. And I remember when I was working at this large facility, they had somebody come in from one of the large training certification bodies, and they were throwing out, does anybody know where the psoas muscle attaches? And everybody sat back, and nobody said a word, and I would start rattling off, and he'd start throwing out muscles he thought nobody would know, and I kept rattling them off. And then I realized, okay, I have something here, because there's a lot out there that people are just memorizing without understanding how it functions based on where it attaches. And so that gave me the confidence when I went into these environments with the pro sports to be able to say, okay, here I have something different. And without this specialty, yeah, there's no way I would have been able to have broken into those ranks. So
so when you say it was the trainer that was gone and they reached out to you, was it their athletic trainer? And,
I think in this case it was a massage therapist. So
okay,
they had a massage therapist that was out, and
okay,
but then once they brought me in, they ended up seeing the value of it and keeping me on staff. So
okay, that's great. And then
yeah.
what is your experience? I mean, working with the Colts for 16 years. I mean, what's that been like? I mean,
It's been great. Obviously, the first year I was with them, we won the Super Bowl, so that was a pretty incredible experience.
wait,
But
you have how many
uh,
rings?
yeah, I have fewer than you. One of those you got because of one of our players, which is okay.
Exactly.
Um, but um, yeah, I mean, the experience with them has been great. I mean, fortunately, the training staff over there has been wonderful, as far as they really want to get the best out of what we're doing. And so that means giving me the space and the actual time to do what we're doing, versus just kind of throwing me in there and saying, here's a couple minutes, do this. So there's been good communication with the medical staff. And so I work on the medical end versus the sports performance. And um, so I'm more in the business with them of helping put back together. But then there will be times where with certain players I'll be doing maintenance
Hmm.
type of work as well. And that's where the RX process has just been amazing, and being able to kind of pull all that together. So
So can you explain that? I mean, for people out there listening that don't know about the progression, I mean, you started out at the specialist side of it, and literally it's, I mean, very specific. Wherever you see a limitation in range of motion, means that one or more of the muscles across that axis are potentially weak, and then you have the tools to be able to assess to determine which muscles are weak, and then you activate them, and then you have increased mobility and stability. That's kind of the foundational principle at the specialist level. Then you get the master level. I mean, that kind of increases your thought process and refines the skills. But then bringing in the RX, can you talk about that transition and how you apply it to different clients, the specialist and master level program versus the RX program as a whole?
yeah, and I mean, as I talk to some people here that are doing MAT, that are working towards their mastery, I mean, I always encourage them. It's not, obviously when I started off, I was getting results, and that's why I got in with the Pacers and the Colts. So it's not that you're not getting results with the specialist level, and then moving into the master level specialist, I felt like that kind of hone my skills in a little bit better, as far as saying, okay, when we go into this position, these are all the muscles that cross that joint, and this is how we approach this in a more of a kind of a systematic way. And then with the RX process, that's kind of completely taken it to another level, to where there might be times where if I was having some trouble getting somebody to hold with certain muscles, the RX has helped take that to the level to where we can really hone in, lock in those muscles and those positions, and then be able to move forward. So it gives more of a I know, like, for instance, one of the players that I work on, we've gotten through the entire process, and then we'll come back every week and we'll just go in and we can say, okay, pattern 1 and pattern 7 are off, but everything else is looking good. And it really gives you a chance to identify you know where their strengths and weaknesses are. And then also, like with him, I'm like, I don't want you to tell me what's going on, let's see if we can find it. And it always turns up which has been pretty amazing. So just the amount of confidence that it brings in knowing the muscles so well and the patterns so well, and then two, just the next level of benefit that the client's getting has been pretty amazing.
Mhm.
So
And isn't it, I mean, you said that like in the conference and they're talking about where's the psoas attached, and you think about back in your anatomy in kinesiology. And I remember being like, wait a minute, hamstrings, there's medial hamstring, M for membranosus. And I mean, you kind
right,
of you memorized, I mean, your anatomy when you went through and looked at origin and insertions. And it's one of the things I always said with MAT is we're going to teach you anything and everything you need to know about the muscle system, how to evaluate it, I mean, where the muscle, how the muscles function when they shorten, I mean, how they contract, what the movement is, what axis they cross, and all the where the origin and insertion is, and what are all the synergistic muscles related to it, and really having a specific view of every muscle. And I've always said it since the beginning. It's almost like when I teach it, it's like you have to picture being the muscle, like the
right,
gastroc being on the condyles of the femur, and actually they create rotation and as they create a knee flexion force, but they're at the other end holding on to attaching through the Achilles tendon and to the calcaneus and controlling subtalar joint pronation and bringing it back into supination. And it's like all this is happening at one time. And you literally have to be able to see it, understand it, and kind of picture it. Where it used to be, well, the gastroc is a plantar flexor and knee flexor, and trying to remember where it attaches. Well, what's the difference between the membranosus, the tendinosus, the two divisions of the membranosus, the short head of the bicep, the long head of the bicep femoris? I mean, so many different things, and what are their function and how do they differentiate it? It is a unique way of looking at the body. But you think about what you've learned and how you've applied it from range of motion leading to muscle testing all the way into the RX process. And in the RX process, when he said he got through this athlete's body, there's 276 muscles on each side of the body that we're accountable for, that we can test and treat. I mean, so what's that? 552 muscles that by the time you've gone through somebody's body, you've accounted for the function of 552 muscles. What an undertaking! I mean, that is, and you can say that like about psoas and where it's attached, but then you think about, the longest capitis and the longest coli superior division, and all these different muscles that you rectus capitis posterior major, all these muscles that, wait a minute, what are these muscles? And not only what are these muscles, but what do they do? And how do they function? And how do you test them? And it's like, I mean, you're continually in an education process when you go
right.
to work, and maybe explain that experience, how it evolved from first thing putting your hands on people probably for the first time because you came from the personal training side of it to where you're at now.
Yeah, well, I mean, just in talking about what you're saying, I mean, I realized as I got into this, how much of our profession, or and sometimes in rehab in general, is memorized. And I'm like, if you don't understand where the muscle attaches, you can't understand how it functions. And I just remember one time about watching a pro trainer, not with a team that I've worked for, and he said, "Oh, the psoas is tight." And I said, "Well, where does the psoas attach?" And he didn't know. And I thought, well, if you don't know, then how do you know what you're applying is actually working? And so that just got me thinking a little bit more. And then I started looking at, I know when I was training, I was looking at things like the sit and reach test, and they're saying, well, this gives you a number. And I said, well, what does that number tell you? I mean, you could have short arms, short
Right.
legs, long leg, what does it tell you? And there's all these different joints that motion could be coming from. So I just started questioning things differently. And so then as I start getting into MAT more, I mean, that the whole beginning of just getting comfortable with working with the body, and starting, let's say we're working lower leg and foot, I honed in on that. And I mean, every night I remember lying on my floor and just studying, and my hands on people all the time, and to the point to where it becomes second nature. And then as you continued through that process, it's been pretty amazing to see how just all of it starts to come together. I know with the RX process, for example, when I started with the foot, I mean, I studied my tail off. When I started with MAT, it was my weaker point. I didn't understand it as well, to the point to now I feel like it's my strongest point. And it was just a lot of hard work and studying. But what would happen, I mean, when I would go through the RX process, I might get through 2 steps of the process in an hour. And I mean,
Mhm.
I'm like, geez, it's taken me weeks to get through the foot, to where I could treat 7 or 8 steps in an hour now, just from repetition and being so
Yeah.
comfortable with getting into position. So just the progression with that has been really, really cool. So it takes a minute to get there, but as you start to see it coming together, it becomes a powerful force, and knowing when to apply it, and when to use, regular MAT on something, and or how to combine the two if necessary.
Right.
Um, so
Yeah, and that's one of the neat things of being a practitioner. I mean, in every field they talk about, like a physical therapy practice, a chiropractic practice. I mean, we're going to work every day, and we get to practice. I mean, literally, I mean, every day is an opportunity to learn and practice our skills, get better at our skills, kind of refine the work that we do. And as you know, I mean, shoot, I mean, way back in 2003, we're sitting there. I always say every 6 months I look back, and man, I've learned so much in the last 6 months. And sometimes you're like, man, I wish I had that client back, because I think I know
right,
what was going on and why they were so complicated. And the funny part is now 25, 30 years later, I'm sitting here every 6 months, I still look back and say, man, from that experience that I've had in the last 6 months of clients coming in every day, it's exponential what I learn in a 6 month period now, where you think that it's over. Once you finish the education, once you finish specialist level, okay, I'm done. And then you go to master level, okay, I'm done. Then you go to RX level, and it's like, I'm done. And you're not done. You have the tools to work with, that you start refining in your perfection. Then you start being able to see things from a whole nother perspective, because of the experience that you have. And
right,
so I think that's the neat part of the process, is we're never done learning. And every time we think we have it figured out, somebody walks in the door and lays on the table and blows away every thought process you have. And the nice part is, with the tools that we have with MAT, it gives you the ability to assess and say, wow,
right,
whatever, that just made you weak. And I have no idea why that made you weak, or why your body's weak. Like somebody will say, well, why is this muscle shut down? I have no idea, but you put forces on it that your body couldn't tolerate. And once you exceed the tolerance level of those muscles, it causes inhibition. And our job is to identify it and correct it, because as you activate muscles, you bring more strength and stability to the joints that they support, and it starts to reduce pain and reduce injury, or the risk of injury. And so it's a process that allows you to learn, us to learn from every day. And I think that's what you're saying. I mean, from where you started, it doesn't minimize what you learned with the specialist program, but some people come in a little more complicated, and you have to figure
right.
out how to blend all the tools that you have, from the specialist level to master level, and all the way to the RX level.
Yeah, and I think just, getting to a point too. I mean, and obviously, um, working with pro athletes, I mean, you have about 2 minutes to gain their trust, and
Yes.
being able to figure out, okay, what's going on here. Sometimes you go to the biggest elephant in the room, but sometimes you go to where you can affect the quickest to gain that trust. Because if you don't have the trust, then you can't help them, and
Right.
then laying that groundwork. But um, yeah, it's been a pretty phenomenal experience. When as I look back and I'm talking to clients, and I'm kind of regurgitating some of the things that I've studied in the books, at joint structure and function, and all of those kind of things. When you start to go back and you start to explain, okay, well, the knee's a hinge joint, it goes where the hip and the foot let it go, and you start explaining, and I'm thinking, man, just where I started to where I am now. And I remember coming out to the classes at the beginning, and I've told some of the girls here that, it's, don't get discouraged if you don't know something initially. Because I mean, I struggled, like I said, with the foot at the beginning, and the more I put into it, the more I started to get comfortable with it. And I mean, I remember those first few classes, not first few classes, first few years where I'd come out to Denver and my brain would be fried when I left,
Mm.
and thinking, man, and to the point to where now it's like, oh, okay, this makes sense, and we move right on,
Yeah,
and so that part of the education process, or reading joint structure and function and knowing, I'd have to read a page 10 times, and then
yeah.
after I get through the course, I read through it and I'm like, okay, and then I'm on to the next, and so it's been a pretty cool evolution of the education process for sure.
Yeah. And one of the things you said that like with athletes where you have to gain their trust, I mean, you get a short period of time to prove yourself. But it's not about proving yourself. About helping them and then giving them the confidence that you can have a positive effect on their health. And one of the interesting things, the dynamics that I was thrown into and being with the Broncos now, I think this was my 25th season this year. And coming in, and I had a biomechanics background and understood the interrelationships of joints, how the foot, the ankle, the knee, the hip, the trunk, all the way to the occiput are interrelated. And if they come in with knee pain, it could be coming from above, it could be coming from up below. And you got 5 or 10 minutes to work on these guys and find out what's contributing to their problem. And that's what I realized like years ago prior to doing MAT. We had this biomechanically based process when I worked in physical therapy groups that was, we do an hour and a half assessment and say, okay, now we going through physical assessments and come back next week and we'll start your program. An athlete has to play on Sunday. They don't want you to go through an hour and a half assessment and say, come back
Right.
next week. And if you only got 10 or 15 minutes with this guy, you can't be spending the whole time assessing. And that's where the tool of MAT is. What's jumping out from a range of motion limitation, and let's identify and treat what's jumping out, because I know the hip has something to do with the knee and there's a limitation in hip motion, or I know the foot has something to do with the knee. And that's where the greatest limitation is. It's like the assessment can take 2 to 3 minutes instead of an hour and a half, and you're already helping them. I mean, within the first 5 to 10 minutes, you're already making positive change on their function. And that in that environment, like you said, with pro sports, I mean, you have to have the tools to be able to do that. And I think that's a great tool. And we've been in the same, you for 16 years, me for 25 years, in the same realm, working in the NFL with NFL organization. And it's, I mean, they send them through, and they if they don't trust you and they don't feel better, they're not coming back.
Right. Right. Yeah. I mean, it just the whole process has been amazing. Just to understand that. I mean, when somebody comes in and you can tell them, kind of to your point, where in 2 minutes you end up giving them more information than they've received in the last 6 months with what they've been doing, just based off of the simple range of motion evaluation and knowing
Yeah,
what has to happen when you can't go into a certain position. And that's what I always find the most amazing. And just sitting back and, if I'm working on a kid, watching the parents' eyes get really big and say, you don't have to sell it hard. You show them and they understand.
yeah,
And I think I didn't realize so much until I got into this, how people want to know the answers to what's going on versus just treating the symptom. And
right.
that's where this has been extremely powerful, with helping people understand actually what's going on versus just saying, okay, I heard you here. Let's treat this specific area.
Mhm.
So,
Yeah, like why do I hurt here? And
right.
or oh, my hip flexors are tight,
Yes.
or my psoas is tight. Well,
Yeah.
why is it tight? I mean,
Yeah. And I always say something's putting you in position for that pain.
right.
And that's really what we're looking at. We're not necessarily looking at the pain, but what's putting you into position to have it. And that's where I feel like it's so powerful, this tool that is so unique. I mean, I know I'm always talking to people with the foot. I mean, I probably spend half my days working feet, and it's just, I if I could think of one and I could utilize something that was more powerful, I would. But I don't know anything that's more powerful than that RX process, especially with the foot. I mean,
Mhm.
it's amazing, and just what that sets the groundwork, or even just the thought processes. Let's say you've got stuff going on in multiple parts of the body, but we know the foot is really a mess. So let's stabilize the foot, so we're at least decreasing stress up that chain. And then by the time we get up there, now things can calm down faster. They're not constantly running on flat tires. And
Yeah.
just putting those together over the years and with experience has been just interesting and fun.
At one point, didn't you say like you're doing a lot more foot stuff with the Colts themselves? Isn't that a part of the direction?
Yeah, I mean, I think just because that's been a place I feel like I can make a big impact very quickly, and just in knowing that that there's so many things that stem off of that between the knee and the hip, and those guys, as you know, I mean, their hips are excessively tight for the most part, and you're not going to get rid of that tightness in a second. You can stabilize it, but where can I take the most stress off so that hip's not constantly feeling that stress? And so that's kind of how I look at that. And it's worked out well. I mean, I certainly work other parts of the body, but the foot has been one where you take a running back or a wide receiver, somebody that's a speed guy, and say, let's make sure these are firing on all cylinders so that the rest of the body can then react. Because if the feet are sensory detectors, we want to make sure they're detecting the ground so that then the body can then react to that. So.
Yeah. And I think that's an important point for people listening, and like, why is he talking about the feet? I mean, we look at it from this whole biomechanical perspective and from an MAT perspective, I mean, the foot's the first thing that hits the ground, and the rest of the body has to react to what the foot does. And across the board, I mean, due to wall-to-wall carpeting and shoe wear and orthotics, and it's like the feet have been catered to. And so the muscles from the knee joint down that attach and create function at the foot, I mean, 90+% of the population are dysfunctional from the knee down. And so being able to provide stability through the foot is a huge factor. I mean, we talk about, I mean, pronation or excessive pronation is an epidemic in the shoe wear and function industry. And it's like, well, muscles move bones and muscles hold bones in proper alignment. And I mean, orthotic can provide artificial support, but it's the muscles that have the contractile ability to stabilize joints and put the bones in the right position at the right time. And what's so, I mean, complex about it, there's literally 28 bones and 55 articulations in the foot. I mean, 55 joints in the foot. You got all these bones that are supposed to, I mean, absorb shock and then become a rigid lever through propulsion and gait. And the only thing that can make that happen, it's not ligaments and it's the muscles, because muscles have the contractile ability to stabilize joints and move those joints and put them in proper alignment when they need to absorb shock, and put them in proper alignment so that the foot can become a rigid lever when it's time to propel over the fixed foot. And so having a foot just there in itself, if you create stability at the foot relative to the ground, everything else, I mean, everything else up the chain benefits. And that's what Chad's talking about and been working with. And I mean, I always say, I mean, what's the most important area of the body? We could say the trunk, we could say the foot, we could say, I mean, depending on what we're talking about, we can say it's so important because every joint functions off of the other joints, but the foot is the first thing that hits the ground, and the rest of the body has to react to what the foot does. So it's a great intervention tool to bring MAT into foot mechanics.
Right.
Yeah. And so it's kind of neat to say, like, sometimes we say no muscle is more important than any other muscle in the body. And like I said, 276 muscles on each side of the body. That idea we're only as strong as our weakest link. And when you're dealing with high level athletes, I mean, athletes are great at compensating. But there's a certain point
this is
in
one
time.
beef I have with you, Greg, because everybody comes to me and they think, well, you must not be that great because Greg says athletes are the easiest to work with. But then I turn it around, I think what Greg means is athletes are so strong they can compensate through things, so you're less likely to, for anything to go awry. But athletes, like you mentioned, are such powerful compensators, especially at the pro level, that your eye has to be really attuned to every slight compensation. So
if you're good at what you do, we'll put it that way. If you're good at what you do, then athletes are easier than the general public. But no, it's exactly what you're saying. And so athletes are great compensators, and that, I mean, they can have weaknesses but because they're great compensators, they have enough strong muscles to compensate for the weak muscles. So they don't come in saying, man, my knee and my back are all killing me, because they have enough strong muscles to compensate for their weak muscles. In the general public, you get people that are broken down and I mean, that are aging and more dysfunctional, and the integrity of their nervous system is so low, they don't have enough strong muscles to compensate for their weak muscles. But exactly what you're saying, it puts it in the other perspective, because athletes are so good at compensating. That's why I said you have to be good to make that principle true, is because they're so good at compensating. If you don't identify their compensatory mechanisms when you're doing muscle testing, they'll compensate and you'll get a strong test when they actually have a weakness, because all they got to do is shift their hip a little bit to find a position of strength, and you'll get a strong test instead of a weak test. So as a practitioner, you have to be more refined in your skills to identify the weaknesses on an athlete. But on the other side of it, if you do happen to miss something on an athlete, it's less detrimental than if you miss it on someone in the general public.
Right. Yeah.
So now that we got that beef taken care of.
Right. Okay. That's good. I've been thinking about that for a long time.
Yeah. Well, now it's out there. Yeah. So anything else you need to say? I mean, being in it since, 2003, and having the experience you've had at the professional sport level, to the everyday clients that you see on an everyday basis that do come in way more dysfunctional than the athletes. Is there anything you can say, as we close up here, to people that are interested, intrigued, to learn about the process, to find a practitioner to experience the process? Any words of advice or 2 cents that you want to offer?
Yeah, from a practitioner standpoint, I think just, staying with the process, and, the more you have your hands on people, the more you learn, and the more you learn. I know when I started the process, I didn't know how to market. I didn't know how to do any of that. But I knew that the more that I studied and got confident with my skills, the more it sold itself, because the work will sell itself if you do that right. So from a practitioner standpoint, it's just knowing that, hey, this is a grind. I'm going to continue to go through this. And like you said, every 6 months I'll look back and it'll be a whole new level. From a client standpoint, I always say, somebody will say, well, my brother-in-law has this, should he come and see you? And I would say, I would absolutely look at this through the MAT process, because I've just seen so many powerful things happen with it. And some of the best clients are the ones that have been everywhere and haven't gotten better. And MAT just has a way of looking at it so differently and so thoroughly that they end up sometimes being the easiest people to treat. And so from a client perspective, I would always say, find yourself a good practitioner that you feel comfortable with, and ask the hard questions. I always say, if I'm going to tell you to do something, or ask you to not do something, I'm going to explain why. And that's what I love about MAT, is it gives you the whys, it gives you the answers. And I can show them a rubber band with where the psoas attaches, and we can look at where the axis is, and we can say, do you see movement here? Do you see movement here? And it's very clear. You can't argue with physics. And so that's been an amazing part of that process, just with getting people to understand kind of what we know and how we can help. Because at the end of the day, you want somebody that's confident with what they're doing. And I think MAT provides the education and the skill level to make you, as long as you put the work in, completely competent with what we're doing. So, and should be able to communicate with any other practitioner. And again, as you and I know, working in the pro sports realm, it's a matter of understanding politics and understanding, we're a piece of the puzzle, and understanding where you fit in. And so this, although we believe it is the main piece of most puzzles, it's also understanding how to work into that, so you can gain the trust and be able to actually get your hands on people to work. So,
well, I think that's an important point. A lot of people want to make different modalities competitive with each other. And it's like that. One thing I can say is, especially, 30 years in pro sports, and is understanding, there's specialists, in all fields in at the pro level, and they're all good at what they do. They wouldn't be there if they didn't bring benefit to their athletes. And the key is being able to explain, we're not competition, we're an adjunct.
Right.
Because anytime you increase mobility, we want to make sure that you're stable through that newfound range. And if we get muscles activated, then corrective exercises now become reinforcement exercises, because many times they can't correct this communication issue between the nervous system and the muscle system. So you get the muscles jump started, then they go back and get better results from their therapeutic exercises or corrective exercises. So it's really making sure everyone knows we're not here to say everything else is wrong and this is right. We're here to say,
Right.
this is where we fit in the big picture. And when you work in pro sports, you wouldn't be there for 16 years, and I wouldn't be there for, 25 years with the Broncos if you didn't fit in with if you weren't able to fit in with the other modality or the other practitioners because you're thinking your competition. You have to learn to, as a
Right.
team, just the way the quarterback and receivers have to work together. It's the chiropractors, the MAT practitioners, the PTs and the trainers, massage therapists. Everybody has to work together. And with the Broncos, the head trainer, Steve Antonopoulos, we'd come in, it'd be Guru Day. And we'd have Michael Leahy, who developed ART, me, who developed MAT, and the chiropractor and the massage therapists. And it's everybody's there on the same day, and the athletes will jump from one table to another. And it's like, well, we were able to say, okay, after we have mobility, now let's just make sure it's stable. So this is how it all blends together. And it's no competitiveness to it. It's we're there for one reason. It's to benefit that athlete to help the team as a overall unit. And so I think that's important, is we have strong beliefs in what we do, but we also know where it fits in the industry. And I think that's a key. It's not a competition. It's an adjunct to every other field out there.
Right. Yep. I completely agree.
Cool. Well, Chad, thank you for taking the time and being
Thank
here for
you.
this. And good, again, pleasure. I mean, you've been around since the beginning, so
Right.
we've had a long relationship and enjoyable relationship.
Yes.
So thank you
Yes,
for
I
being a
appreciate
part
it.
of MAT.
Yeah, thank you for sharing it with the masses so that we can all help people. So
All right, that's our goal.
I appreciate it.
All right, thanks a lot.
All right. See you, Greg.
Goodbye.
Yeah.